Come in.
Hi, Ms. Jovanoff. I'm
Hi.
Julie. I'm going to be your PA student today, taking care of you.
Okay.
So, what brings you into the office?
Well, I just have some really bad abdominal pain, like here.
Okay.
So I figured I should come in and get that checked out.
I don't blame you. I'm sorry to hear that you're having abdominal pain. How long have you had this?
It's been going on about 2 or 3 days now.
All right, and just to get a little bit more information about you so we can figure out what's going on, I'm just going to ask first about you and then sort of go into your social history, family history, and sort of like what brought you in today.
Sure.
So how old are you?
I'm 21.
And what's your occupation? Do you have a job or are you a student?
I'm a student right now. During the summers and winter breaks, I waitress.
And you like your job? Is that good for you?
I do. I really
Okay.
like waitressing.
Cool. And have you had any other health concerns like prior to this abdominal pain? Like how was your like overall general health been?
Generally, I'd say I'm pretty healthy.
Okay, good. Good to hear. Are you married?
I'm not.
You're not? Do you have a boyfriend?
Right now, I do, yes.
Okay. Have you had any like pertinent medical things going on in your life, like right before this abdominal pain? Any trauma, anything like that?
No, nothing like that.
Accidents, hospitalizations related to this sort of abdominal pain?
Nope.
Okay. So when did you say this? You said it started 2 or 3 days ago, this abdominal pain?
Yes.
And then with one finger, can you point to around the general region of where this abdominal pain is?
I'd say right here.
Okay. So right quad. And was this abdominal pain sudden or more gradual?
It came on pretty quickly. Just all of a sudden, I was having really bad pain.
Okay. Sorry to hear about that. What were you doing when the symptoms first began? The abdominal pain, was there any significant things that you were doing? Were you outside? Were you climbing steps, playing sports?
I had just finished eating lunch that day. So at first I thought maybe I just ate something that I didn't agree with or anything, but
Right.
now it's persisted.
Right, okay. And then how's your diet persisting now? Are you not getting the meals that you need?
Um,
Are you
I'd
eating
say-
3 meals a day?
I'd say I eat when I'm hungry, typically 3 meals a day, but since my stomach started hurting, a little less.
Okay. Is there anything that makes the symptoms worse? Any exercise or sleeping when you go to lay down?
I haven't tried to exercise yet. Some positions that I'm sitting or standing in may bother it a little bit.
What positions would you say that is?
I'd say maybe if I'm hunched over.
Okay. Is there anything that makes the stomach pain feel better at all in terms of like either positions or medications?
A lot of times if I just remember to stand straight or lay down, that'll help. I took a Tums the other day. Didn't really help that
Not
much.
helpful. Is the pain getting worse since the first onset about 2 or 3 days ago?
I think so. It's not too terrible right now, but it has increased since 2 days ago.
Okay, has this ever happened before?
No.
Have you had any abdominal pain at all before this? At all?
No.
Nope. How would you describe this abdominal pain? Is it like sharp, dull, shooting, aching?
I'd say if I'm in an uncomfortable position, it's shooting.
Okay.
Most of the times it's kind of achy.
So just to clarify, so if you're more like hunched over, it's like the shooting, and then besides
Yes.
that, it's more of like a chronic ache or
Yes.
like a long-term ache.
Yep.
Okay. Does it travel to another spot at all? The stomach pain.
It does, actually. I didn't know if they were related. My right shoulder's been hurting.
Your right shoulder. Good to
And a
know.
little bit of my back.
We'll get into a little bit more of your shoulder later.
Okay.
How would you rate your pain on a scale of 1 to 10, with 10 being the worst pain that you've ever felt in your life?
I'd say if I'm doing something that makes it hurt a little bit more, it's probably like an 8.
Mm-hmm.
Right now, it's like a 5 or 6.
Okay, so at the worst time. So this would be when you're hunched over, it's more of an 8.
Yes.
Chronically, it's a 5 or a 6.
Yeah.
In terms of the timing of this pain, is it more like worse in the morning, at night, during certain times of the day?
After I eat some meals. Normally not breakfast, but lunch or dinner.
And how long after you eat the meals?
Maybe an hour.
All right. Okay, so just to dive a little bit further into this, what's your normal weight?
140.
Any recent weight changes at all because of this stomach pain, have you noticed?
Not that I've noticed.
Does your clothing fit tighter or looser?
Pretty much the same.
The same? Any weakness, fatigue, or fever?
Maybe a little weak. I don't really feel like myself.
Okay, and when did this weakness come on?
Around the same time.
Anything make this weakness worse or better?
No, nothing that I've noticed.
It's more of a chronic?
Yeah.
And is this weakness all over your body? Or is it generalized in a
Normally
location?
just upper half of my body.
Okay. Have you had any fatigue?
No,
No
no more
fatigue.
than usual.
Have you taken your temperature recently at all?
I have not.
And you haven't noticed a fever, any
No.
hotness? All right. Have you noticed anything different about, you said after you eat you're getting this pain, and is it in kind of the same spot after you eat, or is it more
Yeah, no, it
middle
pretty
stomach?
much just stays around the same spot.
Okay, and then have you had any trouble swallowing?
No.
Any heartburn?
Nope.
And then your appetite, you said you eat when you're hungry still. It really hasn't affected. It's just more
Yeah.
after the fact.
Yeah, it's just more after the fact that I kind of oh, maybe I should have eaten that.
Okay. 3 meals a day?
Yes.
And then how would you say your appetite is? What do you normally eat? What's a typical meal for you?
Last night I had chicken, mashed potatoes, and broccoli.
Any nausea?
No, not really.
Irregular bowel movements?
No.
Any diarrhea, constipation?
Not too much. But now that you mention it, I was a little nauseous the first day.
Okay. How would you describe this nausea? Is it more is it nausea focused in your head, more in your stomach area?
Definitely more my stomach.
Anything make it better or worse?
No, I didn't really do much for it.
Does the nausea still persist?
Again, just after meals.
Have you had any nausea like this before in your life?
No, occasional stomach bugs, but...
Okay, not like this.
No.
So how would you rate this nausea? You're saying that before, on a sort of better side, the stomach pain was a 5 or 6. How would you rate the nausea?
I'd say it's about the same, maybe 4 or 5.
And then in terms of describing it again, sharp, shooting, dull, more of an aching, chronic
Just
nausea.
kind of a dull, I know it's there. It's not affecting me too greatly.
Has there been any changes in the stool color or size? Is it darker, lighter than usual? Is
Not
it more
that I've
watery?
noticed, no.
Okay. What about in terms of your bowel habits? How many times do you have a bowel movement a day?
Once.
Once. And has these bowel habits remained the same?
Mm-hmm.
Any pain with going to the bathroom?
No.
Have you had any bleeding or any tarry colored stool, black stool?
Mm-mm.
Do you have any history of hemorrhoids that you know of?
Not that I'm aware of.
Okay. Constipation? You said no.
Nope.
Diarrhea?
Mm-mm.
Abdominal pain? You're saying yes. This
Yes.
is what.
Yeah.
Your eating habits?
Yeah, they're still pretty good.
Is there anything that you can't have? Like you were saying you get nausea after you eat, but is there anything like totally like, oh, I'm not going to eat that anymore because the nausea is so serious?
Noticed it kind of started if it was like very fatty food.
Mm. And what would you describe as a fatty food? Like what types of food?
Like I had McDonald's for lunch the other day.
And this is really when it started to get worse?
Yeah.
Okay. Have you had any excessive like gas, like belching?
Mm-mm.
Have you had any jaundice or like yellowing of the skin or your eyes?
Nope.
Fingernails?
Nope.
No.
All good.
Any trouble with your liver that you know of?
Not that I'm aware of.
Any trouble with your gallbladder in the past that you're aware of?
No, not that I'm aware of.
Have you had hepatitis?
No.
All right. Just a couple more questions in terms of your symptoms. So this is more like relative to the shoulder pain because you're saying you're having this radiating pain.
Sure.
But is it more of the muscle that's hurting or the joint? Do you know? Are you able to recognize?
I'm not really sure. It's just kind of
all
over.
Okay. And when did the shoulder pain begin?
Maybe a day later after the stomach pain started.
Is there anything that makes it better or worse?
No.
Have you had any shoulder pain like this before?
No.
On a scale of 1 to 10, how would you describe this shoulder pain?
I'd say it's like a 4. It's not too troublesome.
Is it stiff at all? Any muscle stiffness, either in your shoulder or all over your body?
No, I don't think so.
Arthritis?
Mm-mm.
Gout or backaches?
Nope.
Have you noticed any swelling, redness?
No, not that I've noticed.
Any tenderness or weakness?
No.
In terms of the pain, you were saying it's mainly like your right upper quadrant and your shoulder. Is there any pain in the rest of your body?
No, just in this area, yeah.
Are you limited in your motions at all? You were saying you haven't exercised since, but like in terms of like daily motions, like driving, cooking, things like that, has it restricted any movements?
No, nothing that I've found yet.
Have you had any recent trauma or neck pain?
Nope.
Have you had any joint pain with fever or chills?
No.
Any rashes?
Nope.
You said you haven't experienced any weight loss?
No.
Not recently? No. Okay. All right, thank you. Now I'm going to ask a little bit more of information about your medicines and your allergies and things like that, just to get a full workup and health history to really see what's going on.
Okay.
So are you taking any medicines? This could be prescription, non-prescriptions, prescriptions that aren't prescribed to you, vitamins, minerals, things like that.
I am on birth control.
Okay. Do you know what the brand name is?
It's Laren.
And is it oral?
Yes.
And you take it once a day?
Mm-hmm.
Have you had any dosage changes around this birth control?
Not recently.
And do you know how many milligrams your tablet is? I can look it up if not, no worries.
I'm sorry, I don't know.
Okay, that's okay. Besides this birth control, are you on any other medicines?
Just occasionally ibuprofen for headaches.
And how many ibuprofens do you take when you do take it for your headaches?
1 normally solves it, but if not, I'll take 2.
Okay. Do you have any allergies at all? Medicines, food, environment?
Just the penicillin.
Good to know. And how did you realize that you were allergic to penicillin?
I got it when I was given penicillin when I was younger, and I got hives all over my body.
Wow. How old were you? Do you remember?
Maybe 5.
5? And you're 21, so that would be
2000.
Any specific allergies to latex iodine or chlorhexidine?
No.
All right. So just to get like a full health history, I'm going to ask a little bit about your childhood illnesses and then your adult illnesses, like anything like recent within your adult history in the last 6 months. But let's start with your childhood illnesses. Are you aware of any illnesses as a child, and how old were you?
No, not that.
None?
Not that I know of.
No hospitalizations?
Nope.
That's good to hear. Do you know if you have any history? I'm just going to name a few things. Tell me if you've had them.
Okay.
Measles, mumps, chickenpox, rheumatic fever,
Nope.
scarlet fever, polio, or any psychiatric disorders as a child?
No.
No, neither.
Nope.
Any earaches at all? Chronic earaches?
No, I don't think so.
The flu?
Maybe once or twice.
Do you know how old were you?
One I think was when I was like 14.
And did you go to the hospital for this at all?
I didn't. I
You
just stayed home from school.
Did you get any antibiotics or fluids?
No.
Nope. So just rest worked?
Mhm.
Yeah. Any hospitalizations as a child? Broken bones?
I fractured my ankle.
And how old were you?
10.
10. And were you hospitalized? Were there any complications with this fractured ankle?
Nope. Just typical.
All right. In terms of your immunizations, are you aware that as a child were you up to date on your immunizations?
Yes.
To name a few, like polio, MMR, flu, tetanus, diphtheria, pertussis,
Yep.
Hep B, chickenpox, your pneumococcal? Okay, good to hear. All right, and getting into your adult history within the past 6 months or anything really, really pertinent, have you had any illnesses at all? Any hospitalizations?
No.
Have you had any hypertension or diabetes?
No.
TB?
No.
Heart disease, lung disease, kidney disease?
Nope.
Thyroid disease? Any HIV seizures?
No.
Cancer, asthma, or hepatitis?
Nope. Nope.
So in terms of accidents and injuries, were there like any traumas, any hospitalizations that you're aware of?
No, just that fractured ankle.
When you were at 14?
Yeah.
Okay. So no surgeries? Did you have a surgery with this broken ankle?
No.
No. Okay. All right. Do you know if you're aware of your immunizations as an adult? Are you up to date?
Yes.
Okay, so just to name a few, your flu shot, Hep B, zoster?
No.
You're not. Okay. Pneumonia shot?
No, not yet.
In terms of your screenings, have you had any screenings at your 21? Have you had a pap smear yet?
Yeah, just the pap smear.
And then are you planning on getting your mammogram and your colonoscopy and things like that when you need it? Have you had a TB test at all?
I have.
Yes. Do you know the date of your last TB test?
I think it was sometime in March or April.
March of this year?
Yes.
And were there any atypical findings?
No.
No. So was it the one in the wrist?
Yes.
Yeah. And it came back negative. Have you had any cholesterol tests or like tests in order to determine if blood is in your stool?
No.
No. All right. All right. And in terms of like your women's health history. At what age did you get your first period?
13.
13. And some of these questions may feel a little bit uncomfortable. If you're uncomfortable at any time, just please let me know, and I'm happy to stop. How often or how long is your typical menstrual cycle?
About 4 days.
How would you describe your flow? Is it light? Is it medium? Is it heavy?
Medium.
When was your last menstrual period?
2 weeks ago.
Have you ever experienced any absence in your periods or any really, really painful periods?
No.
Me either. So it's pretty regular.
Yes.
Do you know the date of your last pap smear?
That also was in March.
Okay. Do you have any histories of any STIs?
No.
Have you ever been tested?
Yes.
So, have you ever had any pregnancies?
Nope.
All right, and in terms of your family history, I'm going to ask about your siblings, your parents, your grandparents, and you said you hadn't had any kids, so I don't need to worry about them.
Okay.
But in terms of your paternal grandfather, are they alive?
No, he passed away at 84.
And do you know what he passed away of?
Congestive heart failure.
Your parental grandmother, is she still alive?
Yes. She's 84.
And how is her health?
I know she has high blood pressure.
Cholesterol?
As far as I know, it's fine.
Any history of like diabetes or cancer or anything?
No.
And then your maternal grandfather, are they still alive?
No, he passed away at 74.
I'm sorry to hear that. And do you know what he passed away of?
Pneumonia.
How was his health when he was alive?
Not very good.
Not good. Do you know anything about it, or just all around just not good?
Just cancers, diabetes.
Okay. What type of cancer?
Skin cancer.
And then your maternal grandmother?
She is doing well. She also has high blood pressure. She's 74.
And then besides that, do you know if she has any high cholesterol, diabetes, cancer histories, anything like that?
No, not that I'm aware of.
No. Okay, so in terms of your mother and your father, are they still alive?
Yes.
Okay, and how old are each of them?
My dad is 50 and my mom's 49.
And are you aware of their health state? Like, have
they don't have anything that I know of.
no hypertension,
Nope.
cardiovascular,
Mm-mm.
cholesterol,
Nope.
cancers, mental illnesses?
No, they seem relatively healthy.
Good. Good to hear. And do you have any siblings?
Sister.
A sister. Just one?
Yes.
And how old is she?
She's 18.
How is her health status?
She's doing well.
Alrighty. Is there anybody else that lives in the home with you? Is it?
No.
And are you at school? I'm assuming you're at school.
I am, yes.
Okay. So just to like recap, and if anything rings a bell in terms of your grandparents, your parents, you, or your sister, please tell me if you haven't already if they've had any of the following. Headaches.
My mom and I get headaches.
Okay. And do you take anything for these headaches?
Just ibuprofen.
And does it subside with ibuprofen?
Yes.
Okay. Seizure disorders, strokes, mental illness,
Mm-mm.
suicide, substance abuse, thyroid disease, coronary artery disease, hypertension.
Yes. My grandma's.
Oh, yes, I have that down. Thank you. Cholesterol, you said no?
Nope.
Okay. Diabetes?
Yes, my maternal grandfather.
Maternal grandfather. Asthma?
Nope.
Tuberculosis? Renal disease?
Mm-mm.
Arthritis? And any major allergies?
No.
and then cancers we talked about. Okay, and then going into